I'm Liz Davenport. I'm the Interim Chief Executive at Torbay and South Devon Foundation Trust. We're an integrated organisation and work really closely with colleagues within health and social care, in particular Torbay Council. And I've been asked to talk a little bit today about our experience of working with people in Torbay who are homeless and live on the street. This is an area of concern, I know, for our local communities and for local public, but from a health and care perspective, we see relatively low numbers of people coming through the hospital. Actually, the bigger concern for us is the use of drugs and alcohol, and particularly spice. And it's those sort of issues that tend to bring people into care. When they do come here, we do our very best to support them and give them advice and information, and also to give access to other support. But our kind of sense is it's not as big an issue as maybe the public perception has. Clearly in the winter we're very concerned about people who are living on the street in Torbay, and although we saw a small increase in the March period of people coming in with symptoms of cold, or people maybe who have come to minor harm as a consequence of altercation that they had come to with people in the street, the particular issue remained drug and alcohol services. And we will continue to work as an integrated service to support those people as much as we possibly can. Our priority is to continue to work with the council to support them, to help people find alternative ways of supporting themselves. I think the bigger issue for us is homelessness that's been driven by drug and alcohol utilisation, and particularly within the young we have seen a significant increase in spice. There is access to services, and we work very closely with mental health services. We have a psychiatric liaison service that are based in the department, and we can access immediate mental health services for anybody that comes here within an hour during the day, and that's a really positive service. I think that's one of the biggest strengths. We work very collaboratively with health and care. We're an informal arrangement with the council, but we work very closely with the police. We work really closely with charitable organisations. We work very closely with Devon Partnership Trust as a mental health and learning disability provider. So I think the systems are there, the will is there. It's just trying to find the solutions that people want and make a difference to some of the choices that they're making.